Thanks, Tracy. And good morning, everyone. And I was probably blushing a little bit there, but so yes, I'm Sue Rosenhain, and I'm speaking to you here from Wurundjeri lands. I'm in the northeast suburbs of Melbourne, and the land's looking glorious this morning after a nice drop of rain last night. And I too would like to acknowledge the traditional custodians of the land and pay my respects to their elders past, present and emerging. After hearing Patricia speak, I'm even more pleased that we invited her to speak to us and that she was able to come. And the consideration of how we honour the work of people who've gone before us and the thinking that's gone into, and the time and resources that have gone into thinking about how we can address some of these concerns for social issues that we all have. And I'm really pleased that this framework and the work of the partners in the Inner East and beyond, and I know there's a lot of work happening on addressing social inclusion and building social inclusion across the state and beyond, can continue the work of entities even if they're no longer funded to do it. And I think it's important that we can continue to build on work and learnings from those who spent such a lot of effort and honour their work. So just to note that if you've got any questions so I'm going to take you on an overview of the framework in just a moment, but to note that if you've got any questions for either Patricia or myself, that you can put them in the Q&A, and at the end of when I've gone through the framework, we'll be answering some questions. Probably if you want to hear from Patricia and questions for her, I'll be around a little bit more accessible to most of you afterwards, so we'll prioritise those. And also to note that any of the questions that come up in the Q&A, we'll be doing a written response and sending that to everyone who registered for the session. So you can absolutely ask any questions that you might like, and even if we don't get to answering them today, then we'll get back to you. We'll also like to suggest that if you'd like to talk about application of the framework in your own particular context, that you can email us, leave your email in the Q&A or email us via our website, and we'll be back in touch. Okay, so I'm just going to share my screen as we start on this, and I'm going to take you on a tour of the framework. So in 2017, as Tracy said, the Inner East Integrated Health Promotion Partnership identified social inclusion as a priority for health promotion action, building on some of the work that had already been established and identified by MSIC in the Inner East. And while social inclusion underpins all health promotion as a matter of equity and social justice, as a specific area of focus, this was a new priority for health promotion, which therefore required the partners to build a shared understanding of how to approach the work. Initially, it was important to decide on the definition of social inclusion that we were going to use to inform our work. As we've heard from Tracy, the group adopted the definition developed by the Australian Social Inclusion Board, as it is consistent with the principles of equity and social justice, and because it directs analysis and planning to consider the environments that enable social inclusion rather than focusing on individuals. And as we've heard from Patricia as well, that was particularly the focus of the board too. And we know that even more so now, having heard her address. The framework has been developed to guide actions that will promote social inclusion and an inclusive society. It includes a definition and expansion of the definition, not a definition, the definition that we've just heard about of social inclusion, an outline of the guiding principles and values that inform the work, a model explaining the factors that make a society inclusive, an explanation of how social inclusion relates to other key concepts such as social connectedness. And interesting to hear from Patricia how that was a consideration of the board, and social connectedness and loneliness is one of the other dimensions that the framework thinks about, how these concepts relate to social inclusion and how we can make sure that work that is being done on other priority actions can complement one another. And we've also got some case studies that demonstrate social inclusion in action. As Tracy and Patricia have already noted, the definition is composed of two key elements. The first element is the identification that social inclusion is when people learn, work, engage, and have a voice. And Patricia's guided us through what all the thinking and consideration was at the time of the development of the definition and why these dimensions were all so important. And this has certainly resonated with us as we've built our work through the Inner East and thinking about what it is that means people can be included. So we've heard that learn means that people participate in education and training and lifelong education as a consideration of that. And interesting that one of the case studies is actually about the development of new University of Third Age opportunity done by some of the Opening Doors graduates. And that absolutely links in with what Patricia was saying, that we think about learning as a lifelong experience. And working, that people participate in employment, unpaid or voluntary work. Again, really important, that dimension of the definition for us. And another of the case studies is considering how to increase opportunities for volunteer work. And the importance of recognising family and carer responsibility. Engaging for people connecting with others, using local services, and again, the emphasis on local cultural, civic and recreational activities, which has been important for us too. And having a voice, as Patricia said, the importance always that people can have an influence on the decisions that affect them. The second element, that people have the resources, opportunities and capabilities they need in order to learn, work, engage and have a voice. And having resources includes having access to transport, adequate income, housing, digital connection, urban design, community facilities and social infrastructure. So if we're thinking about our work, then working towards all of those things, towards being able to learn, work, engage and have a voice, all contribute to building social inclusion. People have opportunities when there's freedom from discrimination, which of course can take many forms, such as race-based discrimination, gender, gender identity, sexuality, age, faith, abilities. So freedom from discrimination of all forms enables people to have the opportunities to learn, work, engage and have a voice. And also when there are options, a variety of means for engaging. Having capability includes a freedom to choose, physical and emotional capacity, self-respect and adequate nutrition from a secure food source. This second component, that people have the resources, opportunities and capabilities they need, is where we can be directed to think about the circumstances in which this can occur. How does our society function to enable this need? Does this occur equally? Do all people have the resources, opportunities and capabilities they need? Or are some people missing out? What is the cause of any inequality? This is where we need to focus our work. The framework is intended to be an instrument to guide this kind of thinking, to assist us with our analysis of the situation in our own context, to support action planning that is within our sphere of influence, which is consistent with looking at societal and systems change, not individual level, to promote evaluation and reflection, and also to encourage conversations between people who are interested and able to contribute to complementary action. The framework uses the socio-ecological model of health as a way of understanding the norms, practices and structures that enable or provide barriers to people having the resources, opportunities and capabilities they need to learn, work, engage and have a voice. And in doing so, it helps us to understand and explore the questions that I was posing previously. So how does our society function to enable this need? The need for people to have the resources, capabilities and opportunities they need to learn, work, engage and have a voice. And does this occur equally, or are some people missing out? But this is what we don't know in this forum. Anyway, so interestingly, the socio-ecological model developed by Broff and Brenner in the 1970s is the theory to explain childhood development. This model of health has been used widely in health promotion to inform a determinants approach. And that is to help us understand the social factors that determine or cause the health outcomes that we observe. And one of the other reasons that we chose this theory in the social inclusion framework was because it's also been used by Our Watch as the underpinning theory in Change the Story to explore and communicate work towards prevention of violence against women. And prevention of violence against women and building gender equality are another key priority of work for the partners in the Inner East. So it was to also build on the momentum that's within the workforce and broader community and of understanding that Change the Story has built. So we wanted to be consistent. And so the model identifies that norms, practices and structures operate at the individual, relationship, community, institution and society levels, operate here to determine social outcomes, health outcomes, such as social inclusion. Social norms are beliefs, values and attitudes. Social practices are the expression of these norms in behaviour and social structures are the formal and informal systems through which we organise our society. Social norms, practices and structures are influenced by, so there's a backwards and forwards relationship here, they're influenced by one another and they influence by and influence one another. For example, in a democratic country, we can enact a law, that is, create a structure, if it reflects enough attitudes of the attitudes of enough of the population. Equally, once a law is in place, people's attitudes, norms and practices will change. So I'm just going to divert from social inclusion for a moment directly, although clearly there have been some learnings about social inclusion of the experiences of our last year. So a recent example of the relationship between norms, practice and structures is the social distancing requirements and mask wearing to limit the spread of coronavirus. Think about how your attitude to wearing a mask may have changed over the last 6 months. To be honest, prior to that time, I didn't even own one or had not particularly used one outside work, moving in a hospital, being in a hospital. And then I actually started to feel a bit naked and if I was going out without one. And I certainly now will keep one on hand for circumstances beyond corona. And as a community, we accepted the law, the structure that came into place requiring us to wear masks, most of us, overwhelmingly most of us, because it reflected good public health evidence. And it made sense to us. Subsequently, this requirement, the structural change to wear the mask and to socially distance, has changed both our practice and behaviour and our attitudes, our norms. For me, and I think for many others in the wider community. So, back to the framework, more specifically, the framework also includes 6 case studies. As the framework is new, there are no case studies demonstrating its use as a planning tool from program outset. What the case studies do illustrate, however, is how the elements of the framework can be applied to contribute to building social inclusion. Some of the examples were in operation in Melbourne's Inner East at the time the framework was being developed and were informed by the thinking. Others are examples of practice that demonstrate the approach despite being implemented independently. For example, one of the case studies describes an approach taken by Eastern volunteers and their partners, including the Inner East Primary Care Partnership, to build the capacities of organisations to provide opportunities for people experiencing disability or mental health issues to volunteer work in their communities. This project identified that organisations engaging volunteers required support and capacity building and encouragement to address the norms and beliefs about who can be a volunteer, how a wide range of people can contribute, and also to put practices and structures in place to enable opportunities for people with disabilities to volunteer. Another of the case studies is the Opening Doors program. Opening Doors runs a 6-month leadership program for grassroots community leaders to support them develop programs that build social inclusion in their community. Since its inception in 2009, Opening Doors has graduated 251 community members who have the passion, network and skills to foster meaningful and lasting social inclusion in their communities. The program has supported the development of more than 160 unique and innovative community initiatives, which have connected with many thousands of other people within their communities in new and positive ways. Many of the elements of the social inclusion framework are demonstrated by the Opening Doors program. Recognising that leadership programs are often out of reach for many grassroots community leaders, that is, there's a structural barrier to both having opportunity and capability. Opening Doors addresses this barrier by providing an opportunity and the resources for community leaders to develop their capacity to engage with others and to build the opportunity and capability for everyone to have a voice. Furthermore, program participants are encouraged to think about the norms and attitudes, practices or structures that provide barriers to engagement for people within their communities and to design their programs to address these barriers. By working with community leaders to initiate programs that change norms, practices and structures within their own spheres of influence, Opening Doors extends its reach far beyond the participants that attend the program, enabling sustained change in many different arenas. There are 4 other case studies, one of which we're going to hear from shortly in more detail, but the others focus on addressing the norms that limit opportunities for older women to have a voice. And this is work that's been done by Women's Health East in partnership with the Inner East Primary Care Partnership, a program called WASI, Women, Ageing and Social Inclusion. Another case study focuses on building the structures and fostering norms to providing young people with the opportunity to engage and have a voice in their community. And this is work that's been led by the East Gippsland Primary Care Partnership and who've developed the East Gippsland Mental Health and Wellbeing Network. Another is about developing the structures to provide resources and capabilities to support digital inclusion for people in social housing in order that they can learn, engage and have a voice. And we're going to hear about this in more detail shortly from 2 of the practitioners who've been from the Inner East Integrated Health Promotion Partnership who've been involved in this work as the last presentation in the session this morning. The other case study works on, and I mentioned this earlier, is about addressing the norms and creating structures to provide older people with the opportunity and resources to engage and learn. And that's work being done by Opening Doors graduates to extend the University of the Third Age program in the Inner East. As Patricia said earlier, there are other concepts that interact with social inclusion and other social issues. And some of these are the focus of current policy and action. And working on these can also contribute to increasing social inclusion. So the framework discusses these social issues and their relationship to social inclusion to help promote integration of effort and outcome, so that we're not siloing our work and that the work done in one area can build on the work done in another. So the concepts discussed are social isolation, loneliness, social capital, social cohesion, community connection, and social exclusion. So for anyone working on any of these issues, this framework also demonstrates how the work can be linked and how can all build on promoting social inclusion. The framework is relevant for anyone who's working to enable people to learn, work, engage, and have a voice. As well as health promotion practitioners, this includes people whose work contributes to social planning, urban design, policy development, engaging with communities, addressing discrimination, education and teaching in its many forms. In fact, any context in which people are in contact with one another and trying to build that contact. The IEPCP will be providing other opportunities for people to discuss application of the framework in your own context. And if you've got any questions, as I mentioned, either in the session today or afterwards, feel free to contact us. The framework will be available from our website, and I think it's also been sent this morning to everyone who's participating today. And you can also contact us via the website. Before I go into questions, an opportunity for questions, I'd just like to acknowledge the assistance that's been given to Amy Whelan and Debbie Wood from MESH, who've worked with us on the development of the design of the framework, and also Debbie, who's worked with me on the development of the animations for this presentation this morning.